Doctor?
Am I okay to start? Welcome. Thank you for being here today. I'm Dr. Salud Johnson, the County Executive Officer for the County of Ventura. We are exceptionally pleased to have the Congressman Carbajal here today as we are working very hardly to address opioids in our county. And this is not just something that we are addressing here in Ventura County and Santa Barbara County. We have our sheriff here, Sheriff Freihoff, our DA, Eric Nazarenko, as well as our counterparts, Sheriff and DA from Santa Barbara County, because we want to show support and a united front. As I've said before, opioids are affecting all of us here on the Central Coast, but not just that, throughout our state and throughout our nation. Our sheriff and our DA have been at the lead and forefront of educating our community, talking about what they're doing in their collective agencies to address the fentanyl crisis, and educating our public that one pill can kill. So we are extremely grateful to have this federal support from the congressman. Our congressman continues to represent the Central Coast while he's working and advocating to keep our community safe and free from this deadly drug that has just caused too many deaths that did not have to occur. So we want to say thank you to him for his efforts advocating to keep our community safe. I know he's going to talk some more about the work that he's doing, and we're also going to hear from our colleagues here in Ventura County and in Santa Barbara County about their work as well. Thank you for being here.
Thank you, Dr. Johnson. And thank you to all of you from the media and various outlets that are here to cover this very important issue. I want to, in particular, thank, in addition to Dr. Johnson, Sheriff Brown, Sheriff Freihoff, and District Attorney Nazarenko and Savron for joining me today. This bill is a bill that has come forward as a result of many of our law enforcement agencies throughout the country and public health officials raising the alarm that we have a crisis before us, an epidemic of fentanyl that is creating a huge spike in deaths. And on occasion, I have the privilege of convening a meeting with our law enforcement personnel, of which many of them are behind me. And this is an issue that they have been raising to my attention and raising the alarms on for many months and years. We're here to talk about a deadly threat to our communities, fentanyl, and new legislation that I helped write, not just legislation, bipartisan legislation, to increase federal attention to this opioid legislation that is on the president's desk right now on the verge of becoming law. It's not if, but when the president signs it, and that should happen any day now. Our nation's opioid epidemic is not new. For decades, we have been dealing with the rise in substance abuse of opioid painkillers, sometimes as prescription drugs, and sometimes as street drugs, alternatives to those powerful narcotics. But in recent years, the synthetic opioid fentanyl has made this epidemic so much deadlier. In Ventura and Santa Barbara counties, overdose deaths from fentanyl have spiked dramatically. 181 fentanyl-related overdoses in Ventura County last year, and 115 in Santa Barbara. That's nearly 800% higher than 5 years ago for Ventura. In 2017, we lost 32 in Ventura and 22 in Santa Barbara. We have multiple front lines of this fight against fentanyl. We have our healthcare professionals who are working in our clinics and substance abuse treatment centers to save lives and help people struggling with addiction. But we also have our law enforcement like our sheriff and district attorney, who are working day and night to keep this deadly drug off our streets. But because we are not the only community dealing with this threat, we are not limited to local responses. The law that I co-led in the House is asking our Department of Defense to treat fentanyl for what it is, a national security threat. Excuse me, my eyes are just watering here. Our bipartisan bill that passed Congress last week requires the Pentagon to develop a specific counter-drug strategy for dealing with fentanyl and the cartels that are trafficking and smuggling this drug. We are pushing them to improve their coordination with American law enforcement like DEA, the Border Protection agents, and local police and county sheriffs. And their coordination with foreign governments that are also dealing with these traffickers, specifically Canada and Mexico. That may not initially seem like a lot, but let me explain why it's critical, and it's a critical step. I'm a veteran of our military, and I'm also a veteran of county government, local government. I know in both cases what it means when one hand is not talking to the other. On occasion, we get that. And that is what we are trying to solve here. We are asking that our military or our law enforcement develop a more coordinated, better strategy for dealing with one another in addressing this crisis, so that we ensure we are all working in the right direction together. For the sake of hundreds of families on the Central Coast that have lost a loved one to fentanyl, we owe it to them to ensure that bureaucracy, siloing, and interagency coordination are not getting in the way of our counter-drug efforts. This, plus the work that is being done across our region to crack down on trafficking and help those who are struggling with addiction, is what it will take us to curb this deadly drug once and for all. This is really getting to the root of the source of interdiction at the border. And we will be more effective by all working together, not only within our own country, Department of Defense and law enforcement, but with authorities in other countries, so that we can go after these cartels and make sure we are interdicting this deadly drug. I will now turn it over to District Attorney Eric Nisarenko to give his local perspective on this battle against fentanyl in Ventura. Let me just get my notes out of the way here.
Thank you very much, Congressmember Carbajal. I want to applaud you and the members of both the Senate and the House for passing this urgent, pressing, and timely bill. It's also worth noting, as you mentioned, that this was a bipartisan effort. And we see bipartisanship not too often these days. And it is nice to see it move this bill to the President's desk. I think the Disrupting Fentanyl Trafficking Act reflects on a national level what we are experiencing here at a local level. And that is that this is a deadly and lethal crisis on the Central Coast. Think about it. Last year, 2022, 181 overdose deaths in Ventura County. That's more than 3 individuals each and every week. I also want to share with you a grim milestone. Year ending 2023, we had 676 fentanyl-based criminal filings. 676. By way of comparison, in 2019, prior to the pandemic, we had 18. This is the highest number of fentanyl-based criminal filings we have ever had in Ventura County history. It reflects a more than 3,000% increase over the 5-year period. So when we look at this crisis and we highlight it and amplify it as a national security risk and as a national security danger, we are bringing the full force, resources, attention, and reputation of the Department of Defense and the United States military to combat and fight it. And Congressmember Carbajal, I want to thank you. Your leadership, along with Congresswoman Bices, and the bicameral approach from Senators Ernst and Kane has led us to this moment. We need, in local law enforcement, more equipment, resources, and money to interdict and seize fentanyl flowing into Ventura County streets, because as this bill reflects, this is international and transnational in scope. Chemical parts from China flowing into clandestine Mexican labs that end up in the pipeline on Ventura County streets. We need a global, international approach to dismantling, disrupting, degrading, and fighting this scourge. I want to thank you again for co-sponsoring this legislation, and I urge President Biden to sign it into law. Thank you.
Introduce the next person.
It's now my pleasure to go ahead and introduce my friend and my colleague, Santa Barbara District Attorney John Sabernack.
Thank you, District Attorney Masarenko. I absolutely value the efforts we have made since we have both attained our positions as District Attorney, and nowhere is it more important than dealing with fentanyl. In my almost 32 years as a prosecutor, I've never seen a public safety and public health crisis like we're facing with the proliferation of illegal fentanyl. Illegal narcotic usage used to be considered a slow path to an early death. With fentanyl, death is always just one dose away. Fentanyl's fatal effects, they don't discriminate between new users, people suffering from long-term addiction, and people who are poisoned because they didn't know they were ingesting fentanyl. Illegal fentanyl is by definition wholly unregulated. Two pills from the same stash can look identical, but yet they can contain vastly different quantities of the potentially dangerous and lethal drug. And that makes a huge difference, because with fentanyl, a tiny grain or two is the difference between life and death. Reducing fentanyl deaths are going to require a multidisciplinary approach encompassing education, treatment, harm reduction, and law enforcement interdiction to reduce the supply of illegal fentanyl. Congressman Carbajal's efforts to include the Disrupt Fentanyl Trafficking Act as part of the National Defense Authorization Act acknowledges the devastation caused by the illegal fentanyl trade and recognizes the influx of illegal fentanyl as a national security threat. The Disrupt Fentanyl Trafficking Act will help to reduce the flow of illegal fentanyl into our country. This in turn saves lives, because every dose of fentanyl is potentially lethal. I want to join Congressman Carbajal as he stands with those grieving lives lost to fentanyl and take whatever steps we need to take to address this crisis. It's now my pleasure to introduce Ventura County Sheriff James Fryhoff.
Thank you. I would like to echo the remarks made by both district attorneys from Ventura County as well as Santa Barbara County. This fentanyl scourge that we are facing requires a full court press. Congressman Carbajal, through a bipartisan support, has got a bill that's on the president's desk that he needs to sign. There's a three-legged stool for what we need to do, as mentioned by the DA Sabernack. Supply-sided enforcement, demand reduction, which is through education, as well as harm reduction, which is by tools such as naloxone, as well as addiction treatment. Our behavioral health specialists here in Ventura County are working very hard with those who are suffering from addiction, and as been stated several times, One pill can kill. There is no longer such thing as a recreational drug, because every drug has the potential to have fentanyl in it, whether the person knows it or not. And that one-time using can absolutely kill them. So it's important for our communities to know there is no such thing as a safe drug. You do not know what is in it, and therefore it has the potential to kill you immediately. I cannot state enough how much I support Congressman Carbajal and having this bipartisan bill that we really need to focus on. Like Eric Nazarenko said, we don't see a lot of cooperation these days, but there are much more things that we get along about and we're concerned about than we have differences on. We need to work together on those issues, fentanyl being one of them. So thank you very much. This time I'd like to introduce my partner from the Santa Barbara Sheriff's Office, Sheriff Bill Brown.
Thank you, Jim, and thank you, members of the press, for being here today. I'm honored to be here alongside Congressman Salud Carbajal and my justice partner colleagues from Santa Barbara and Ventura counties. We're here to address this critical issue that affects our communities deeply, the escalating crisis of drug overdose deaths, particularly those caused by fentanyl. Year to date, through the end of September of 2023, we in Santa Barbara County have lost 170 people to overdose-related deaths, with a staggering 88 of them attributed to the lethal presence of fentanyl. It's disheartening to note that in 2021, we had 133 overdose deaths, 78 involving fentanyl, and in 2022, those numbers rose to 168 total overdose deaths, with 115 that were fentanyl related. Drug overdose deaths in Santa Barbara County have now surpassed the total number of people killed annually from homicide, suicide, and traffic accidents combined. Fentanyl does not discriminate in who it kills. Its victims include people of all ages, races, religions, and social status. This is not a partisan issue. This is a life and death issue. In Santa Barbara County, we are losing, for the past several years, the equivalent of a Boeing 737-800 aircraft filled with passengers, and we're losing them each and every year. Think about that for a moment. In our county alone, losing as many people as can be carried in a commercial airliner each and every year. This is untenable, and we have to stop this. And the answer, as mentioned, is a combined approach between education, prevention, intervention, harm reduction, and treatment. This alarming trend has continued for far too long, and it calls for resolute action. The illicit drugs plaguing our country are primarily sourced from two Mexican drug cartels, the Sinaloa and Jalisco New Generation cartels. They operate with near impunity in Mexico, producing and trafficking millions of counterfeit pills containing fentanyl and vast quantities of powdered fentanyl, which is used to lace other drugs and which annually causes the deaths combined of over 100,000 Americans. The highest cause of death between people of teenage years and 45. I stand here today in full support of the bill co-sponsored by